At the outset of this guide, it's important to recognise that coping with sudden change is difficult for most people, ourselves included, and that all of us process and deal with change differently. It was Mary Shelley who said, "Nothing is so painful to the human mind as a great and sudden change." At the moment, most people are experiencing two significant changes, both the physical change to their own working environment and responsibilities, and the wider societal disruptions and social isolation resulting from the COVID-19 pandemic. Either one could be a potential cause of great uncertainty and stress, but both together make it more likely that people will experience increased anxiety and, as a result, may put their mental well-being at risk. As line managers, we're not trained counsellors, but we do have a vital role to play in supporting the mental well-being of our colleagues, maintaining healthy team dynamics, and creating some of the protective factors which can help members of our team adapt and deal with the change in current circumstances, and also cope with the ongoing uncertainty. The situation is serious and will not simply blow over. Things will get worse before they get better, but if we are well equipped to support our teams, increasing their resilience and helping everyone maintain good mental well-being as we walk through uncharted territory and experience this change together. This presentation will give you some tools and techniques to manage your teams well in an online context and help you identify when members of the team may be struggling and need signposting to additional support services. As you watch this presentation, keep in mind how some of the stresses and anxieties described may also apply to you, and consider ways in which you can put in good self-care practices now so that you are better able to support and equip your team to deal with the changing situation as it unfolds. Under the current circumstances, it's important to recognise that there are many potential causes of an increased risk to our mental well-being. These may include a sudden, unexpected change, a loss of routine and a change of duties and working responsibilities, a loss of a sense of purpose and/or meaning, a loss of a sense of control over both day-to-day life and the wider situation, loss of usual social networks and support, lack of physical exercise and mental headspace, anxiety about health, illness, death, particularly in the higher risk groups, anxiety about the health of a family member or friend, increased anxiety about job security and financial stability. As the situation evolves over the coming weeks and months, more people will experience family members and friends becoming ill and may suffer loss and have to deal with grief and bereavement. Therefore, understanding how to support staff through these difficult periods whilst working remotely will be critical to helping to build resilience in individuals and the wider teams, making us more adaptable. People will experience a wide range of emotions, so you will need to be mindful that members of your team will require different types of support at different times in the process. There is no single method or one-size-fits-all approach to supporting staff. In addition to those factors which affect everyone in the present situation, it's likely that some colleagues will be dealing with additional personal circumstances which may make them more vulnerable to stress and reduce their capacity to cope well with change. These may include, but aren't limited to, underlying physical health conditions, underlying mental health issues, loneliness or isolation, living with strained family relationships, being a primary caregiver for mentally or physically vulnerable family members, caring for young children who are not in nursery or school. We all have varying degrees of natural resilience to stressful situations and sudden change. This capacity may vary day to day, over the course of weeks or months, and doesn't remain fixed or static throughout someone's life. Resilience describes our ability to cope with the stresses of everyday life and unusual events without sustaining long-term damage to our mental health. Emotional intelligence can be defined simply as our ability to accurately identify and understand our own feelings in relation to other people and external events, and to recognise and respond appropriately to other people's feelings. The two are linked, as our level of awareness to our own emotional state is key to being able to adapt our behaviour appropriately to overcome stresses and strains on our mental health. It's important for you to know that resilience is not a fixed quantity, and that all of us can become more resilient with the appropriate knowledge and support. Just because someone normally seems to respond well to stress doesn't mean that they will automatically respond well in this situation, and vice versa. However, you can reassure your team that everyone who has ever come through a difficult situation has already demonstrated a capacity for resilience, even if they might not recognise it as such. There are a number of practices which can help to enhance someone's natural resilience. These can be considered protective factors, which help people to better cope with new stresses. There are a number of examples of ways in which we, as line managers, can play an important role in increasing these protective factors. Examples may include creating a regular routine and a sense of normalcy with a new working pattern, fostering a patient and understanding environment as people get to grips with new technology and a different working environment, creating a sense of team in which everyone has a role to play and looks out for one another, encouraging a collaborative spirit that you're all in it together, every member of the team knowing that someone else is watching out for them, every member of the team understanding that they have an important role to play, even if it's simply self-isolating to prevent the spread of infection. Having someone to talk to, involvement in regular social contact, even if it's online. Ensuring that people have access to accurate, reliable news sources. Being encouraged to take breaks and annual leave and pursuing hobbies and activities outside of work. According to the Team Emotional and Social Intelligence model, there are 7 skills that contribute to effective team functioning. Encouraging the growth of these attributes within our teams will increase our collective resilience. Not all teams will be naturally strong in all 7 areas to begin with, but identifying your team's starting strengths and weaknesses will help you to lean on your stronger traits when the team is under pressure. You can use these more difficult experiences to reflect on how well you coped and agree collective strategies for building up those areas which are lacking. Ensuring that the well-being of each individual member of the team is being considered will benefit the overall well-being of the team. There are a number of simple ways to help create a supportive and stable environment. These include ensuring that you set up and maintain regular check-ins and weekly team meetings, keeping the tone light and informal when appropriate. In some settings, it might be possible to create separate social online meetings or coffee breaks, which are more informal and encourage colleagues to share how they're feeling. Try to create a routine and have regular meeting times, but be mindful of the need to be flexible in some cases, as colleagues may have childcare commitments that make certain times difficult. Use webcams involving Zoom, Skype or Microsoft Teams whenever possible. Whilst not everyone feels comfortable initially being seen on camera, the benefits are worth overcoming the awkwardness. Seeing your colleagues, both those talking and those not talking, gives a far greater insight into how people are doing and enables everyone to pick up non-verbal cues and body language which is lost over audio or via email or text. Bear in mind that in some cases you might be the only genuine smile they see all day. Try to schedule 15 to 20-minute one-to-ones with each team member, ideally via webcam each week. Ask questions about their general well-being. How are they finding the technology? How is their home set up? Do they have children and/or a partner at home? Are they caring for or worried about anyone else? Create a team site to allow for less formal communication about projects and tasks. Consider creating a buddy system where team members also check in with each other during the week. Use the opportunity to do reflective team practice using online team surveys such as Belbin or Team Resilience. Share interesting, thought-provoking articles or videos to discuss, for example, TED Talks. They don't have to be directly relevant to your work, although you should exercise caution sharing videos or memes that could offend or be misinterpreted. Create space for people to air their wider concerns and ensure that all members of the team have the opportunity to contribute to the discussion, pulling colleagues in by direct questions if necessary. Ensure you stay informed about the wider situation and you can direct people to reliable news sources to avoid spreading rumours. Encourage colleagues to pursue hobbies and join community forums such as www.nextdoor.co.uk to stay socially connected to the people around them. Occasionally, conflict is a normal part of all team dynamics and can be healthy if dealt with properly. A sudden change to a team can cause teams to re-enter the storming, norming phases as people struggle to adapt to their new dynamics and adopt new ways of working and relating to each other. Old tensions can resurface and situations can become exacerbated by increased external stress, such as illness, anxiety, difficult family situations, or financial trouble. In this case, don't ignore it. Recognise that there may be an underlying source of tension or stress in someone's life that is finding expression within the team. Address it with the individuals offline if necessary to find out if there are any underlying issues. If possible, call out inappropriate behaviour as it happens to signal to the team what is and isn't acceptable. Remind colleagues of the need to be patient with each other as everyone is doing their best. If appropriate, be prepared to be honest about your own struggles so that people don't feel that they are the only one who's finding it hard to cope. The mental health charity Mind identifies a number of potential causes of stress, many of which are now being faced by most people in this current situation. These include being under lots of pressure, facing big changes, worrying about something, not having much or any control over the outcome of a situation, having responsibilities you're finding overwhelming, not having enough work, activities, or change in your life, and times of uncertainty. One way to think of stress is our response to perceived internal or external pressures, threats, and uncertainty. Feeling stress is a normal response to high demands and pressure. Some level of stress can be good for us. It can motivate us to keep us going in difficult circumstances and achieve things. However, when we're unable to deal with stress in the usual ways and return to a healthy baseline, it can become a problem. Our experience of stress is based on our own response to perceived pressures, threats, and uncertainty, which is why two people can have very different reactions to the same situation. An individual's perception of a threat may not appear rational or justified to someone outside the situation, but that doesn't make the felt experience of stress any easier, and being told that anxiety or stress is unjustified is likely to make it worse. Stress can be caused by external factors such as workload, relationships, or physical ill health, as well as internal factors such as self-esteem, doubt, or fear. Being able to identify when you or your colleagues are experiencing stress and having strategies to manage your mental health to prevent that stress from becoming overwhelming will give you a better capacity to fulfill your role and support your team. It's useful to remember that our mental health isn't something that is fixed or static. This table outlines some of the characteristics of the different states within the overall mental health continuum. During a time of upheaval, increased anxiety and isolation people may attempt to conceal the fact that they are finding it difficult to cope. This may be particularly true of people with pre-existing mental health issues, who may be more vulnerable to change and require additional support. Without the usual interpersonal cues, which we rely on during face-to-face discussions with colleagues in the workplace, it may be harder to spot these warning signs. Therefore, it's important to pay attention to what someone may be telling you indirectly over the coming weeks. Some prompts to consider include: are there any significant or concerning changes in their behaviour or personality? Do they seem overly anxious, worried, struggling to cope, or not sleeping? Are they failing to attend meetings or making excuses for not connecting? Has there been a change in their appearance or personal care? Are they maintaining a good diet and regular exercise? Are they obsessing over negative news stories or bleak statistics? Are they expressing feelings of worthlessness or thoughts of self-harm? In terms of responding to the warning signs related to what you see or hear, what are they telling you? What are you observing about the changes in their behaviour? Do you know about pre-existing mental health conditions or potential vulnerabilities? It's important to listen to their concerns without judgment and never minimise or downplay them. It's helpful to summarise and reflect back, for example saying, "What I hear you saying is that you're concerned about, is that right?" In terms of responding to the warning signs related to what you say, it's okay to express your concerns about their health and mental well-being and ask direct questions. In addition, it's okay to tell someone that you want to refer them on to additional support services. In terms of signposting, if you're worried about someone's mental well-being, signpost them to the resources for support and tell them that you will follow up with them. If you feel concerned or out of your depth, talk to your line manager or your HR manager. On airplanes, we're usually told that in the event of an emergency, we should put on our own oxygen mask before helping anyone else. And the same applies with mental well-being and self-care. Here are some good questions to ask yourself or get someone else who you trust to ask you. How is your own daily or weekly routine? What self-care habits are you practicing regularly? What are you worried about at the moment, and where are you getting your news? Who is supporting you both professionally and personally? Are you taking care of your health, diet, exercise, emotional space, and relaxation? Are you taking regular breaks, logging off, and taking annual leave? Are you setting healthy boundaries around how much you take on, particularly in relation to other people's issues? Social media and 24/7 news can be positive ways to stay in touch with loved ones and keep up to date with the wider situation. But they can also be sources of misinformation and unhelpful rumours. Constantly checking the international news, which tends to highlight the worst stories, can result in a state of hypervigilance, in which we perceive external threats as being greater than they are, putting us in an exhausting mental state of high alert. So it's important to ensure that we are monitoring our input sources, both the frequency with which we check them and the accuracy of the sources themselves. This is for our own mental well-being and to provide a potential counter-narrative to any unhelpful rumours which team members may have picked up. We are living through a period of unprecedented change, uncertainty and upheaval. It is normal for us to feel out of our depth, overwhelmed and anxious about our ability to cope. Feeling scared is a legitimate response to the unknown. What we do with those feelings determines how well we will face the challenges ahead. The situation is serious, and we don't know what the next few months will hold. We do know that this will end at some point, and when it does, we will emerge having tapped levels of resilience and community spirit previously unimagined. No one is expecting you to be perfect, All you have to do is show up and be honest. Whatever is happening around you, however out of control you feel, know that you are making a difference. By following government guidelines and reducing the spread of the virus, by caring for your own mental well-being and the well-being of your teams, by providing direct or indirect support for staff across the faculty who are on the front lines of clinical intervention or research to reduce the impact of the virus, by being kind to yourself and looking after your family and loved ones.